we have seasonal malaria chemoprevention, we have routine vaccination, and we have insecticide-treated net. Cash transfer is second highest on the list with significant change. Cash transfer has 48%, even higher than routine vaccination, and more than double the change due to routine vaccination and the use of insecticide-treated net. What do you think that says about the driver of child mortality on the continent and how we currently look at helping or intervening?
That's a good question. And also, that was another really good finding because, like I said, this program wasn't designed for the infant and child outcomes, and yet we are still seeing them. To answer your question, this is my perspective, okay? When you look at the other interventions that are very high on this list, malaria chemoprophylaxis, mosquito nets, and childhood vaccines, their mechanism of work is by attacking one point in this whole pathway. So let's imagine a chain, right? So they are addressing one link of the chain. Mosquito nets will work on mosquitoes, antimalarials will work on malaria, and then vaccines are for just the vaccine. But what we see with cash transfers is that it attacks multiple points in the chain. So what the researchers found was that women who received cash transfers during pregnancy reported feeding better. So they're eating better and having a more nutritious diet, which according to the health evidence shows that increases the likelihood of a healthy birth for a child, but healthy maternal outcomes as well. The second thing that we see in this case, in the mechanism, is that the women who received cash were more likely to rest during their late pregnancy and after their babies were born. So instead of getting involved in the very onerous that a woman is required to do in many African settings, they were able to take time off and rest. The third way that it worked was these women were able to access care during pregnancy, but most especially when they were going to have their babies. So babies were born in health facilities. A lot of women, there was over a 50% increment in women going to hospitals to have their babies, which was better resourced. But fourth, when they got there, they were able to afford the care that was offered to them. And then finally, after their babies was born, they rested more, were able to take their children back for baby wellness checks. But then in addition to that, the study also found that households that received the cash were feeding better. So their children were also able to feed better.